Hi everyone, I'm Rachel Meade, Injury Prevention Manager at Injury Matters. Injury Matters aims to prevent and reduce the impact of injury within the West Australian community, and we do this through advocating for and providing education to prevent injury, as well as providing support to people who have been affected by injury. Today I'll be speaking with Dr Ben Beck, who is President of the Australasian Injury Prevention Network, to discuss COVID-19 and what this pandemic means for injury prevention in Australia and New Zealand, including our response, injury rates, what it means to be working collaboratively, and what some priority actions are in the coming months. To start off with, I'd like to acknowledge the Whadjuk Noongar people, the traditional custodians of the land where I am today in Perth, and pay my respects to elders past, present and emerging. So I guess in terms of the background for this, in January this year, the World Health Organization declared an outbreak of the coronavirus, COVID-19, in China, and they declared it to be a public health emergency internationally. And then in February 2020, the Australian government declared COVID-19 a pandemic. As a result, in Australia, the state borders have closed, interstate travel restrictions apply, non-essential services and businesses have closed, and the government has urged people to practice social distancing and self-isolate at home. Across Australia, the measures appear to be working at the moment, as we've seen the number of new cases slowing, while some state restrictions have begun to lift. We've been told that we should expect social distancing measures to be in place for the foreseeable future. And I guess COVID-19 is impacting on everyone. It's changed the way we live, work, and as well the way we perceive safety. So I'd now like to introduce Dr. Ben Beck, Deputy Head of the Pre-Hospital Emergency and Trauma Research Unit at Monash University and President of the Australasian Injury Prevention Network. Welcome, Ben.
Thanks for having me, Rachel.
So to start off with, Ben, can you provide an overview of your, I guess, interest in injury prevention and what your role currently entails at Monash and with the AIPN?
Yeah, I think I've always had this interesting interest in injury prevention, and it's kind of been driven by a few things. I think potentially one of the main drivers is my father, who appears to have 9 lives, and on our property in Victoria, used to undertake a multitude of risky activities and somehow has lived to tell the tale. So I think as a young child, I was exposed to the need for injury prevention, and it led on to me doing a PhD looking at how people get injured in the backseat of motor vehicles, and subsequently have done a kind of raft of injury prevention work, spent a little bit of time with the Department of Defence doing some injury prevention work there, and then subsequently on to Monash University. So as you've indicated, so my role at Monash is Deputy Head of Pre-Hospital Emergency and Trauma Research, and one of the critical roles that our unit plays at Monash University is monitoring of injury in the state of Victoria. So we house what's called the Victorian State Trauma Registry, which is a population-based registry of our seriously injured major trauma patients. And as part of that, we also follow up our patients at 6, 12 and 24 months post-injury and get a really detailed understanding of the long-term consequences of injury. So a lot of my work now kind of revolves around monitoring injury and understanding causes of injury, and I've got a particular interest in walking and cycling, and particularly in cycling, and I'm sure there'll be some conversation about that today.
Yeah. And I guess, do you want to give a bit of an overview of the AIPN and your role there?
Yeah, so the Australasian Injury Prevention Network, just firstly like to say that it's really nice that we're now called the Australasian Injury Prevention Network, and have a wonderful cohort of our friends in New Zealand who are now part of the AIPN. But we are the leading injury prevention advocacy organisation across Australia and New Zealand, and we bring together a raft of people from government, from industry, from academia, practitioners who come together as a unique body of people who work in injury prevention. And what the AIPN does is provide a forum for those people to be able to collaborate and really work together to advocate for key injury prevention and issues, and also to really try and drive injury prevention as a body in Australia and New Zealand. And so one of the key activities that we're involved with at the moment is the development of the National Injury Prevention Strategy, which will hopefully be launched this year.
Yeah, great. So I guess thinking about the current pandemic, what are some of the injury areas that you expect will be affected, I guess, in the short term, and some of the areas of injury where you would expect to see longer term effects?
Yes, I think at the start of this segment you were talking about how dramatically our lives have shifted as a result of this pandemic and the subsequent social distancing requirements and lockdown measures. And it's really just entirely shifted what we could consider our kind of denominators in terms of our risk exposure to a number of key causes of injury. And so there are a lot of concerns about potential increases in injury risk. And on the flip side, there's also likely some quite substantial reductions in injury rates in certain areas as a result of those declines in exposure. Probably at the moment of biggest concern are injuries related to mental health conditions, so really things like suicide and self-harm. Beyond Blue has noted that they've seen a 40% increase in contacts compared to the same time last year. And so obviously with the conditions that we currently live in, with things like social isolation, anxiety and some of the challenges of this environment have the potential to increase mental health conditions and the symptoms of, and therefore potentially increase rates of self-harm and suicide. And certainly that's a big area of concern at the moment. We have seen some response from government that I know we'll talk about in a second, but really I think that's one of our major areas of concern at the moment. One of the other big increases that we've seen is really in child injuries in the home. Again, coming back to this concept of how the risk exposure profile has changed as a result of this pandemic. Children are spending a lot more time at home. There's been state-based variation in when children have been going back to school, but regardless over this time period, there's been a lot more time that children have been spending at home. And as a result of that, there's been some specific increases in injuries that we're aware of resulting from that. And I take the example of scalds and burns in children. We've seen, our trauma colleagues have informed us that there have been quite substantial increases in these injury rates in children, but also things like falls around the home and other things like that. So that's been certainly an issue of concern. For many, particularly women and children, home is not always a safe place to be. And so while we've seen this dramatic shift towards people spending a lot more time at home, there's a lot of concern around the increase in family violence. Recently, the UN Population Fund have estimated that family violence rates will increase by 20% during these lockdown periods, which is quite substantial and a very scary statistic. And so it's again very difficult to address, primarily because of the lack of opportunity for some of these people who are at risk to be able to contact services when they might have been able to do so when they had time away from people in certain circumstances. So that's a challenging area and certainly something that again that we've seen some investment from government in, which is good to see.
The home's often perceived as that safe place to be, but yeah, in times like this, as you say, for many women, it is not. And then even for children and older people, there's that increased exposure to some of those risk factors in their safe space that they might not perceive that to be the case.
Exactly. I think that's a really important point too. There is around the kind of perception of safety here. So there's a whole lot of activities that we consider to be safe and unsafe. And I think particularly the home is one of those environments where we potentially underappreciate the risk of injury. I have a 10-month-old son at home, and more so than ever am I aware of the potential injury risks, having spent a lot more time with him at home. But touch wood, he's been okay at the moment.
Yeah, okay. And so you've touched on the areas where I guess there's increased risk. What about those injury topics that I guess maybe there's a few more protective factors in place because we are distancing and isolating at home?
Yeah, so I think there's a number of key areas. Workplace injuries is one example where we've seen really a large majority of people working from home. There obviously are industries that can continue to proceed with work during this period, but nonetheless, overall, there's been a reduction in the amount of work being done, and as a result, we would expect to see a reduction in workplace injuries. Similarly, with restrictions on organised sport, we're aware of data that kind of suggests that there's been a huge reduction in injuries associated with sport. And similarly with drowning as well, along similar lines, there's been some restrictions in terms of closing beaches or reducing access to water-based activities. And so as a result of that, we would expect that there would be some reduction in drownings.
So the other area in which we've seen dramatic shifts in exposure is the road transport space. So clearly, as a result of people staying at home, there's been large reductions in motor vehicle based travel and really large reductions in the volume of traffic on our roads. There is some variation in the reports about the degree to which traffic has reduced, but estimates are around the 70% mark. And so typically what we would expect is that that with a 70% reduction in motor vehicle-based travel, that we would similarly expect a 70% reduction in injury rates for motor vehicles, and that hasn't happened. We've seen potentially a 50% decline in injuries and fatalities, but certainly not to the same degree as what we're seeing in motor vehicle travel. And so police are hypothesising that this is really a result of risky behaviour. With lower vehicle volumes, people are able to travel at higher speeds. And as a result of that, we're seeing still far higher crash rates than we would expect for the amount of travel that's happening. In addition to that, and as a result of the Australian government naming physical activity and exercise as being one of the 4 essential activities, we've really seen a big shift towards walking and cycling, which is a kind of a potential positive out of this pandemic, is really that shift away from motor vehicle-based travel towards these active modes of travel that have fantastic mental and physical health benefits.
Yeah, I agree. I think there is a real shift towards people being more getting outdoors where they can and taking up some physical activity, because it gives you that opportunity. I think everyone that has dogs is embracing the opportunity to get out and walk the dog each day.
Yeah, exactly. I think I've enjoyed reading some of the memes just around how people have finally realised why dogs get so excited to go for a walk, because it's just amazing to be able to get outside.
Yeah. So maybe if we talk about, I guess, changes that we've seen across Australia, what are some of the proactive policy changes that governments have implemented to support injury prevention during the pandemic?
There's been probably a few good examples. There's been significant investment in the National Health Plan, and really a couple of key areas of focus there. One being telehealth and being able to provide support and healthcare to communities via telecommunication, which is a great advance and will have long-term benefits for our communities, particularly those in regional and remote areas. We've also seen significant investment in supporting those who are experiencing family violence. So investment in helplines such as Men's Line and 1-800-RESPECT and things like that. So investment in being able to provide support for those in need. Also, as we mentioned earlier, investment in supporting the mental health and wellbeing of Australians through the digital mental health portal, additional dedicated lines for support and investment in that space. So there's some positives, but obviously they are addressing significant challenges that are facing society at the moment. And realistically, we're going to need increased and sustained investment in these spaces to be able to deal with really what we're expecting in terms of both the short and long-term consequences of this pandemic. We've also seen National Cabinet place a temporary ban on gun purchases for sporting and recreational purposes. So some changes there potentially in gun-related violence. In some states, there's been restrictions on the purchasing of alcohol. We've also seen funding to support the home delivery of medications, which has the potential to be able to reduce misuse of certain prescription medications, and also reduce the risk of the drug-related injuries and also medication-related falls. But again, I think there's still a real need for enhanced monitoring and continual monitoring of medications, particularly in our older adult population.
So what are some unique opportunities for injury prevention that you think could come out of this pandemic situation that we as a sector could take advantage of?
Yes, I think there's a number of opportunities. One of them relates to, really understanding how risk and exposure relates to injury outcomes. We've really never had an opportunity, or not for quite some time, to be able to completely shift certain exposures to certain activities and then be able to measure the impact in terms of reductions on injury. So that's one aspect, is to really understand that. From my perspective, and as I mentioned at the start, I've got a particular interest in active transport. And so there's huge opportunities here to be able to shift people away from private car-based travel to these active modes of transport. Really, our car-centric cultures have huge negative health consequences that extend beyond just road trauma. Things like our exposure to pollution and noise and limited green space, obviously physical inactivity. And all of these factors have huge negative health consequences that we are going to perpetuate if we continue to foster a car-based travel. And at the moment, we've had this really dramatic shift towards walking and cycling. And it is fantastic to see. And we've really been seeing all Australians doing everything that they can to try and adhere to physical distancing guidelines and requirements. But the problem is that the infrastructure that exists at the moment largely is simply too tight and too cramped to be able to actually facilitate people to be active, but also adhere to physical distancing requirements. And so what we've done is led a campaign with 100 health and transport experts calling on government to rapidly roll out infrastructure to support walking and cycling. And the concept here is that we need something now. This is not an issue for 3 weeks' time, for 2 months' time, for 6 months' time, for next year. This is an issue that is facing most Australians in their desire to be able to get out, and there's obviously huge health benefits both from a physical and mental health perspective in being able to be active and to exercise. But we need to be able to provide the infrastructure to enable people to do that safely, to be able to go to their local shops, to be able for children to be able to travel to school. These are all kind of fundamental things that we want to be able to support into the future, but our infrastructure at the moment really doesn't support it. And in addition to that, there's also obviously the concern around public transport. I think there's a lot of apprehension from the public in using public transport as some of these social distancing measures start to be relaxed. And because of that, we don't want those trips shifting to private car-based travel. And so there's further justification again for the need for enhanced walking and cycling infrastructure. And just, this is not like really about big cycling superhighways or things like that. They certainly have to be things that we consider, but this is much more at the neighbourhood level. These are people, most of the trips now that we're doing are really around our homes. And so what we need to be able to do is think about how we can modify our neighbourhoods, our local streets, such as being able to extend our footpaths, roll out temporary cycle lanes, or even close roads and reduce urban speed limits to 30 kilometres an hour. And unfortunately, Australia is really lagging behind the rest of the world. We've seen examples across the globe of cities and countries that have really invested in this and rapidly acted. Paris is rolling out 650 kilometres of infrastructure to support walking and cycling. We've seen it in Portland, we're seeing it in New York. And one of the leaders in this space has actually been New Zealand. So New Zealand have enacted changes that have enabled local councils to be able to rapidly roll out infrastructure. And there's also a funding package to be able to support these interventions. And so I wish we were, from an Australian perspective, where New Zealand are, but we've got a lot of catching up to do to be able to support these modes of transport.
Yeah, great. Yeah, I think we're envious of the changes that New Zealand have made in that space, and it would be really nice to see some of the, I guess, yeah, learning from what they've done there and us applying that here in Australia.
Exactly.
So I guess bearing that in mind, what initiatives should our workforce be advocating for at the moment in terms of injury prevention?
Yes, I think one of them is exactly that. So there's a lot that we can be doing in terms of advocating for walking and cycling infrastructure to be able to support both adults and children as they move about their neighbourhoods. As we've spoken about, there's clearly some injury issues that we think are going to continue or increase over time. Talking here about family violence, particularly potentially alcohol-related harm as well, funding for trauma counselling as well following the pandemic. And from my perspective as well, I think this pandemic to a degree has highlighted some of our inadequacies from a data perspective. Mm-hmm. In these times, we would love to be able to rapidly understand what's happening at a population level in terms of injuries. And unfortunately, the routine data that's typically collected across Australia is slow. There are unique opportunities that we've seen, say, for example, in New Zealand with the ACC being able to rapidly report on what they're seeing from a claims perspective, and they've seen really big reductions in the number of claims. In fact, in the first week of New Zealand's lockdown, claims were at around 30% of what they were at the same time in 2019. So these are huge reductions. Unfortunately, we're lagging behind in Australia from a data perspective, and this is not just data about injuries, it's also data about exposure. Obviously, we've been talking here about how our exposure to risk has changed as a result of this pandemic. And with really the exception of motor vehicle-based travel, we don't have really good data on exposure. And because of that, it really hinders our ability to truly understand that relationship between exposure and risk. And so we need additional exposure data, we need additional routine data, we need additional data on the specifics of how these injuries are occurring, so that when we start to roll out interventions, they can be targeted in such a way that are addressing the true root causes of these injuries.
Yeah, okay. So I guess the current situation, like we are today, most of our injury prevention workforce is at home. And having to connect online rather than in person as we might usually do. What do you see the impact of that having on the injury prevention workforce, and what do you think we can do to, I guess, can make sure that the workforce continues to, I guess, collaborate?
Yeah, I think from what I've seen, that the injury prevention workforce has been really responsive and agile at being able to adapt to the current pandemic, and to focus on really where our current needs are. We've spoken about those needs in terms of suicide and self-harm, in terms of family violence, in terms of child injury and things like that. So I think that there's been some fantastic movement to be able to respond to those needs and be able to push out messaging, which has been really good. Obviously, I think there's been an impact on the ability to be able to deliver face-to-face services, and that obviously creates challenges and reduces the ability of the injury prevention workforce to be able to create change across populations. But nonetheless, I think there's been increasing utilisation of technology. We spoke earlier about what's happening from a telehealth perspective across all health services and across the country. And really those kind of tools are going to be increasingly utilised for multiple industries and reasons. And the injury prevention workforce can certainly benefit from those, in being able to use technology to engage with communities and individuals to reduce injuries. So I think that's positive, and I think realistically this is about trying to work together. You've spoken about that, and I think we need to make sure that we can learn from one another and make sure that we're not duplicating efforts.
Yeah, great. And I guess in terms of like messaging, there's lots of messaging going around, being shared at the moment around how we can prevent the spread of COVID-19. What do you think the one message is that you'd like to get across, I guess, in regards to injury prevention, and what that message is that we should be promoting at the moment?
Yeah, I think there's one important message here, and that's that we don't really need to reinvent the wheel. Certainly we've seen shifts in the types of injuries and the causes of injuries that people are sustaining, but nonetheless, the work that the injury prevention community has been doing still applies to these causes of injuries, and it's really just then focusing our efforts on our current needs. And we spoke about those needs, but that's really, we've got the evidence. We know in those areas what works, and so that's really, I think, where we can be focusing our efforts. There needs to be strong consideration for our Indigenous populations now and into the future, and also really ensuring that what we do moving forward really has a true equity lens on it. I think during these pandemic times and in times of recession, clearly there are vulnerable populations, and in general, in these times, we see that lower socioeconomic areas typically are times, and that's across the board from a financial and a health perspective. And so when we do begin to relax some of these measures and think about how we want to change environments to improve safety, we really need to ensure that we're doing that in a way that provides equitable safety for all.
Yeah, great. So thanks so much for chatting with me today, Ben. Was there anything else that you wanted to add?
No, that's all. I think it's I'm delighted to be able to talk on this, and a big thanks to everyone who's been working in the injury prevention space to be able to keep people out of emergency departments, because it has made a really big difference. I think there's some challenging but exciting times ahead, and we're redefining a whole lot of areas, and we need to take those opportunities and make the most of them.
Yeah, I agree. So thank you very much. I really value your knowledge and insight that you've been able to share with us in the injury prevention sector today. I hope that people at home that are listening are also able to take away a few key points and think about maybe what their advocacy efforts are, and can join, I guess, those calls for change, whether it be at a local, state or federal government level. And again, I would like to thank everyone for the hard work that they're doing at the moment. It is challenging, but I think we're doing a really good job to try and keep people safe, when I guess initially I think some people, or I myself was thinking, oh, people aren't going to be focused on injury when there's, you know, acute other health risks. But I guess reiterating what you're saying, I think now more than ever, it is important for us to be preventing injury and keeping people out of hospital. So yeah, thanks, Ben.
Thanks, Rachel.